we're going to do a lovely procedure called a torsional release. And this is subtle, and what we're going to be treating are trigger points in the neck. You can use this technique elsewhere in the body, but it really particularly works well in the neck. So the first thing to do is to find the person's trigger points. So as you know, we've done this many times, that you're going to search up and down your neck, and we're going to assume that she has pain in this area here. So I will feel trigger points are areas of spasm within the muscle. So as I feel along, I'm feeling for a little thickening, and I run my fingers at right angles to the way that the muscles go. So I move back and forwards, and here I've actually found, is that tender right there?
Yeah.
Yeah. Okay, so I'm on a trigger. Now, there are a number of ways to treat this trigger, but this way is actually really elegant and really nice. So that's tender, isn't it? Mm-hmm. Yeah, okay. So now what we're going to do is we're going to explore with movement how to make this trigger go to sleep. So the first thing you do is rotate the way away from me, and what I'm interested in is I'm keeping my finger on the trigger. As I turn, you tell me when it stops hurting or if it doesn't. Does that carry on being sore?
It's sore,
yeah. Yeah, okay. So that's sore, so that's the wrong way to go. You're just exploring. Now, we come the other way. Now, as I turn,
not so.
It's gone. Mm-hmm. So what's happened now is that what I've done is we've rotated. If that stayed sore but started feeling better, I would then just extend and side bend. I do all kinds of movements to try and find the position where the trigger just turns off. And so we'd just do this together, but I can also feel, what I feel under my finger is that I feel that that band or the thickening just disappears. And it should be, it's about there, isn't it? Mm-hmm. And that feels really comfortable. Mm-hmm. Now, at this level, so there's no pressure at all. It's a position, not a lot of movement, just a bit of rotation, a bit of extension, a bit of side bending, anything you can do to make this thing disappear under your finger. And at this point, just breathe in and out gently, and out, and just relax. Feels very comfortable. Mm-hmm. Great, lovely. Okay, so now you do that for about 30 seconds in this way, just nice and gentle. And now what we're going to do is that's the first part of the torsional release. Now what we're going to do is we're going to go back into the pain zone, and we're going to explore how far we can go without turning the pain on. So, in fact, it's there, that's the position. Now, as I start turning, you tell me, I've got my finger on the spot, when you start feeling the pain.
I think it's
Is it gone?
Yeah.
Oh dear. So that worked kind of too well, because normally what would happen is, oh no, there's a little bit there. Is that a bit tender there? Yeah, a little bit tender. So what happened is it's still there, but a lot less. So then what you do is you come back again until it's not tender, and then you just move gently forward again. As we reach that limit, the moment you feel it, then you take a deep breath in and you breathe out, and it's on the out breath that there's relaxation, and then it should settle. You just come back into the pain-free zone, and then you explore a little further, and then she might say, ouch now. So you come back into the pain-free zone, deep breath in and breathe out. So you're always working with no pain, and then you just explore a little further. Actually, it feels like it's just about gone, really, hasn't it?
It's straight up.
Yeah. So there we go.